I just want to invite the next speaker, Dr. Kibur Engidawork, who will be speaking on evaluation of an existing social intervention which aims to mitigate NTD-related stigma in Ethiopia. Thank you very much, and you are most welcome.
Citizens in Asian as well as African countries. Podoconosis is among the NTDs, which is caused by, as I said earlier, the co-contribution of genetic and environmental factors. It develops when genetically susceptible individuals walk barefoot for an extended period of time. It causes severe swelling and chronic disability on patients. As a result, it can reduce people's mobility as well as their economic productivity. It's also among the highly discriminated conditions. Misconceptions about the causes and prevention of the disease, as well as the socioeconomic status of individuals experiencing the disease, as well as those individuals who are perpetuating stigma against patients. There has been a number of studies on podoconosis, and as far as science is concerned, podoconosis is preventable by wearing shoes and keeping foot hygiene. As a result, enhancing people's understanding about causes and prevention mechanisms is very important, as well as enhancing individuals' capacity to take preventive action is also vital. It could be by improving their capacity to buy shoes or to keep their foot hygiene. And following conducting a number of studies, Ethiopian government has identified the disease as one of the neglected tropical diseases that should be given priority. And in 2017, lymphatic filariasis and podoconosis morbidity management and disability prevention guideline came out to assist efforts to control and prevent the condition. Parallelly, a number of NGOs have been implementing health intervention as well as health education interventions on podoconosis, mainly focusing on enhancing people's understanding about the disease and enhancing people's capacity to take preventive actions. They have been also working on treatments or providing treatments for patients. In 2012, this NGOs formed the National Podoconosis Action Network, NAPAN. Yet there is limited information about the impact of those implemented social interventions, particularly from the social sciences perspective. We have conducted a free list of interventions in Ethiopia, and we came to learn that there are about 11 social interventions currently implemented by NGOs to enhance public literacy and health behavior, as well as develop capacity of taking preventive action. And with the help of NAPAN, Mr. Fikre is here with us, I guess, very collaborative with us in identifying those interventions and providing some support letters. So using a predefined selection criteria, we have selected a social intervention known as Next Steps for podoconosis patients in Amara region from the 11 social interventions which are currently being implemented. So we have gone through the literature and tried to understand what's the problem. As Professor Getenet earlier said, social sciences have not been utilized very well in our understanding of NTDs. So I think he mentioned that how important social sciences could be in our understanding of health. So I would say social scientists may not know about bacteria, but they're well informed about the social environment where bacteria operates. And just like that, social interventions also do not operate in a vacuum. They operate in a system so that they can be affected by elements of the social structure, and again, they can affect elements of the social structure. Unfortunately, traditional evaluations approach focused solely on the implementation process of social interventions. As a result, we know little about contextual factors which can influence the implementation process of social intervention. This in turn makes us left with policies which are not informed by social sciences. As a result, there is little involvement from social sciences in informing policies designed to control NTDs. This is the gap we have identified. So to fill this knowledge lacuna, we're planning to employ the CICI framework, the context and implementation of complex intervention, aka the CICI framework. The framework focuses on 3 dimensions: context, implementation, and setting. Now the idea is that social interventions, once again, are operating in a context, which means the cultural, socio-economic, political context of a given setting can influence the way implementations are being implemented. Unless we understand the influence of contexts, we cannot really know the success or the reasons behind the success and failures of social interventions. But it's not enough, according to this framework, to study contexts. We need also to study the whole implementation process. This includes the implementation strategy, the implementation theory, as well as the implementation agents and outcomes. Moreover, the framework tells us to focus on the setting, again, the physical and the organizational setting in which an intervention is put into practice can influence the way an intervention is implemented and affected or in bringing about the intended change. So, once again, to fill this knowledge gap, we aim to evaluate the effectiveness of the social intervention I've said we have selected, which is known as Next Steps for Poroconus Patients in Amhara region. We will assess the role of this intervention in reducing poroconesis associated stigma. We will first explore the influence of contextual factors informed by the framework. As I've said, we are interested in assessing the geographical, epidemiological, socio-cultural, socio-economic, ethical, legal, and political influences on the intervention which is being implemented in Amhara region. We will also assess the various aspects of the implementation, including implementation process, strategies, agents, and outcomes. We then will be focusing on the influence of the setting, the organizational and social environment in which the intervention is being into practice. We finally try to establish the relationship between the context, implementation, and the setting of the selected intervention. I guess this is the quintessence argument of the framework, because we are really interested in studying how these 3 dimensions of the intervention interact with one another in bringing about intended changes. To this end, we have selected a mixed method intervention evaluation strategy, bringing together both qualitative and quantitative methods together. We will first conduct a qualitative study using participant observation, in-depth interviews, key informant interviews, and focus group discussion with selected participants to have a clear understanding about the social environment where the intervention is put into practice. This will be followed by a quantitative approach. We're planning to conduct survey-mated to examine people's perception about the intervention as well as the socio-economic setting of the study area. Following the successful completion of this project, we are expecting that we'll be producing some analysis on the various factors at macro, micro, and meso levels related to the influence of stigma against individuals affected by poroconosis. We will also come up with some findings regarding contextual factors which can influence the success or a failure of a given intervention in a setting, particularly in low and middle income countries. By doing so, we hope to contribute to the end of the neglect of social sciences in NTD studies, because we are employing, once again, social sciences perspective in approaching social interventions. Moreover, we will contribute to the end of the neglect of NTDs by forwarding some inputs for policies and directives. We're planning that NTDs will be planned to contribute to reduce stigma. The public engagement activities, for instance, can create awareness about the diseases which are somehow related to the perpetuated stigma against patients of scabies and poroconosis. So I hope our activities will help us to contribute to the reduction of stigma against patients. So far, in this particular study, we are able to conduct situational analysis to understand the health system in Ethiopia, as well as the situation of scabies and poroconosis. As I've said earlier, we have conducted a free list of existing interventions in Ethiopia, from which we have selected one for this particular assessment. We have developed ethics application is submitted actually for the BSMS Ethics Committee, and we're waiting for some response. I hope we will get that ethical approval soon. A country study protocol has been developed. It's from that proposal that I'm presenting some of the sections. We have also developed some data collection instruments for the qualitative and quantitative phase of the study. I thank you for your attention and